When creating wellness programs, meaning your health and your actual lifestyle for lifelong fitness, you have to think about maintaining a balance of all your joints so that you can move smoothly with strength, but also through a full range of motion. Now, this means making sure that you include all joint movements that the joint is capable of. So, let's talk about your joint movements. If I were to bend my elbow like so, this is known as flexion. If I were to unbend my elbow, that's known as extension. Your joints are capable of moving through different types of movements, with some joints capable of moving through more movements than others. For example, your elbow and your knee are only capable of moving through flexion and extension. So we really only have to program for bending your elbow, unbending your elbow. So a tricep extension is unbending your elbow. That's why it's called a tricep extension. Your knee is capable of extension and flexion. So we do knee extension exercises. We also do leg curls, which is a leg knee flexion exercise. They're only capable of doing those two movements. So very easy to program for your elbows and your knees. Your shoulder, your hip, and your spine are different and capable of more movements, so we have to program accordingly for them. Let's start with your shoulder. Your shoulder is actually your most mobile joint, and therefore it is probably your most unstable, meaning you are most likely to or more likely to injure it. That's why we have a lot of shoulder dislocations, but not a lot of knee dislocations. Not saying it doesn't happen, because it does. It's just more stable knee means less injury or less likely for a dislocation. Okay, so your shoulder is more likely to become dislocated because of the hypermobility it's capable of. It can move through shoulder flexion. It can move through shoulder extension. It can move through shoulder abduction away from your body. It can move through shoulder adduction towards your body. It can move across the horizontal plane or transverse plane. It can move across the horizontal plane in the opposite, which is horizontal abduction. This, by the way, is horizontal toward the body, adduction. Okay. It can do external rotation, internal rotation. All right, so those are your rotations there. So it is capable of performing all of those movements, which means you have to program accordingly so that you get all of those movements in your program within a 2-week period, because that's when detraining or loss of gains or strength starts to happen. So within every 2 weeks, you really need to have these in your program. Now, there are certain movements which are more relative to your daily life, which you might program for, but we'll get into that at later dates. All right, your hip, flexion, yes. Extension, yes. Abduction, yes. Adduction, yes. Okay? Rotation, yes. You cannot really truly get your hip into the horizontal position. So those are in a not applicable, meaning we don't have to worry about those. But hip flexion, meaning bringing your knee up. Hip extension, getting up out of a squatted position, is hip extension. All right. Hip abduction, meaning away. Hip adduction, meaning towards. And then external rotation and or internal rotation. Internal rotation, external rotation. We program for all of these. All right. Your spine is capable of flexion, extension. It's capable of lateral or of rotation as well. Now, the spine is a little bit different in that side bending is a term known as lateral flexion. So we do have lateral flexion capability. We have rotation capability. We have flexion capability, which is a crunch. We have extension capability, which is a back extension. So we need to program for all of these. We left off the board ankle because with an ankle, we really only do plantar flexion, dorsiflexion, which is a little bit confusing for today's lecture. So let's just leave that for later dates, because if you heard plantar flexion, dorsiflexion, there is no extension of the ankle. It gets a little bit confusing until you start to understand these terms better. So, creating your workout programs, you really sort of start to need to understand what the joints are capable of. Then, based off of knowing what movements need to be in your program, you will then start to create and understand the exercises that create those joint movements. Squats, for example, involve knee and hip extension. So writing your program, you know that the hip and knee are taken care of in the extension part of your program. A simple method for making sure that you're truly achieving your health and wellness by creating strength and movement balance in your program to maintain the joint wellness so that you can use those joints to their full capabilities for the duration of your lifelong fitness journey. All right? So start to think of your joint movements as the basis for everything you do for creating your fitness programs. Whatever your goals may be, maintain that joint integrity for overall wellness. All right.